My name is Dr. Satish Gupta, and I've been a consultant in ophthalmology since almost 45-50 years. I graduated from All India Institute of Medical Sciences in 1971, following which I had had stints abroad as well as in India. Cataract is one of the common reasons for loss of vision in the humankind. Normally we all have a lens inside the eye which is transparent, and the lens is used to focus the light on a sensitive layer in the eye that is called as a retina. As long as the lens remains transparent, the focusing capability of the lens remains intact. A person is able to see clearly. But anytime the lens becomes cloudy or hazy because of any reason, that condition is called as a cataract. There are various reasons for the development of the cataract, the commonest being the increasing age. And most people will develop a cataract, or almost all people will develop a cataract if they live long enough. Now, what is long enough? It could be 100 years, or it could be 80 years, it could be 70 years, depending on different individuals. Some people develop the cataract at a younger age compared to the others who develop it at a later age. Why does it happen? Partly it is hereditary, partly it is the effect of the environment. It is also affected to some extent by the nutritional status of an individual. There are some other kinds of cataracts also which tend to develop in the humankind. Some of them are related to injury to the eye, that is called a traumatic cataract. There is a type of a cataract which occurs because of some other diseases in the eye, which is often termed as a complicated cataract. There is a kind of a cataract which occurs at birth in children, and that is called as a congenital cataract. There could also be a cataract which occurs in younger individuals and called as a developmental cataracts. So these are the various other reasons why a person will develop a cataract. Some of the cataracts are also associated with other systemic conditions or other bodily conditions of the eye, particularly a condition like a diabetes, where a person tends to develop a cataract at an earlier age than a person who does not have a diabetes. Any age group could be affected, starting from the early childhood to an old age. Fundamentally, the problem that the cataract produces or causes is defective vision. Initially, the person will find that his vision is becoming cloudy and he is not able to see clearly the objects that he had been seeing clearly till that time. And as the cataract progresses, the visual loss keeps on increasing, and there comes a stage when the cataract becomes what in a lay term is called as mature cataract. At that point of time, a person is not able to see anything except the light. Different people will see these problems at different stages in their life. It also to an extent depends upon the kind of a job or a profession that a person is doing. There are some people who are driving at night, people who are shooting a gun, people who are reading a lot, people who are operating. These people will feel this defective vision at a much earlier age or much earlier stage of the cataract than the people who are performing tasks which do not require that kind of an acute vision. Now, once a person develops a cataract, the only treatment available to the individual is surgery. There is no medical treatment available anywhere in the world as of now. There are people who claim to cure cataract by the use of herbal medicines, by the use of homeopathic medicines, and I want to emphasize there is no medical treatment anywhere in the world which will cure the condition of cataract, or for that matter delay the progression of the cataract. Once the cataract has started, it is going to progress irrespective of what treatment is given to this patient. How fast it progresses, nobody can predict. In some cases it will progress very fast, in the other cases it will progress slowly. People who are diabetics, they tend to progress much faster than the persons who are not diabetic. In days gone by and even today, people who are not well aware of the situation, they will say that the cataract should become mature before it is operated on. That is a situation which was talked about probably 50 years back and is definitely no more true. The criterion for the surgery in today's day and age is that once the doctor says that you have a cataract and the individual concerned says that he or she is having difficulty in his or her professional activity, that is the stage to operate on. And different people, as I said earlier, will experience this difficulty at different stages in their life, depending on the kind of a profession that they are in, depending on the kind of visual needs the person has. A person who is driving at night, even when he has a small amount of cataract in the central part of the lens, will find the driving almost impossible, particularly at night, because of the glare that he or she will face when the light falls from the opposite side. A person who is a shooter, like Rajvardhan Azad, will require the surgery much earlier than a person who is tending to his buffaloes and cows or is a farmer in the villages, because his visual needs are not as much as that of the person who is reading, writing, operating, driving at night, etc. So therefore, the criterion for surgery, to re-emphasize again, is that whenever a person feels disabled in being able to do his or her activity, and that disability is attributed to the visual loss because of the cataract.